and welcome to this podcast for the University of Alabama at Birmingham's CounterACT Research Center of Excellence in Arsenicals. My name is Mina Nabavi, and I'm a program manager in the UAB School of Public Health. Today on the podcast, we are joined by Dr. Ziad Kazi, Associate Professor of Emergency Medicine at Emory University and consultant with the UAB CounterACT Center, and Mr. Terry Tincher, Chief for the Centers for Disease Control and Prevention's Division of Environmental Health Science and Practice Chemical Demilitarization section. This division is important because public law requires CDC to review particulars and plans associated with the transportation and disposal of lethal chemical warfare materials to ensure that public health and safety is adequately protected. Mr. Tincher's experience exceeds more than 20 years with chemical facilities in process design, operations, and safety for several top chemical and fiber optics companies. He began his CDC career in 2004 as a safety engineer assigned to the Environmental Public Health Readiness Branch. Mr. Tincher is a speaker for a Grand Round seminar series as part of the UAB CounterACT Research Center of Excellence in Arsenicals and is recording this podcast with Dr. Kazi.
Thank you so much for being here and taking time out of your schedule to talk with us, Mr. Tincher. Now, to get us started, can you talk about the division that you currently work in at the CDC, specifically the Division of Environmental Health Science and Practice, and more specifically even the Chemical Demilitarization section within that division? What is the mission focus of this division?
The mission focus of this division is to work on environmental health problems. And within our division, we have a group that looks at lead poisoning and prevention. We have another group that works with asthma and climate change and environmental issues with those. We have another group that works with the practices of environmental health, working with our state and local partners as well as the tribes. And then within our branch, the section that we're in, we work on issues from tracking to epidemiology with chemical exposures, radiation, and finally, chemical demilitarization, which is the destruction of the chemical weapons stockpile that we've accumulated since the Cold War. And we were stood up about 35 years ago, originally within CDC to do this. And prior to that, it had been under the Surgeon General's office. And our goal and our mission is to review all the plans that the Army has, because the Army is the DOD's primary agency for chemical weapons, and to review their plans on how they're going to destroy those weapons and do it in a safe manner, because in the years following World War I and World War II, there were a lot of disposal attempts. They burned them, they buried the weapons, they dumped them in the sea. And none of those were great environmental answers. So they had to come up with methods that were environmentally sound. These weapons are stored near population centers throughout the United States, or were, and we had to review those to make sure that they protected the human health, and that also includes workers within the facility. And they came up with some rather unique answers to being able to protect workers and the public. And that is what we continue to do now, even as they go through the final parts of what we refer to as the stockpile. And there are even more challenges because the weapons have gotten so old that some of them literally are leaking and have to be put into what we would call an overpack and destroyed in a different type of facility.
That's really interesting. I know you cover a lot of the history of chemical warfare in your presentation. And of course, the history is fascinating, how they were developed, how they were accumulated by a number of countries around the world, including the US. And of course, how the CDC goes about ensuring their safe destruction. Now, can you elaborate a little bit more on some of the techniques of disposing of these chemicals during this podcast? Briefly, I know you'll go through more details in the presentation.
Years ago, when in around 1970, when President Nixon decided that we weren't going to make any more chemical weapons and then subsequently to destroy them, The scientists of the day said that, these weapons were really designed to be used, not to be destroyed. So they had to come up with different technologies to try to destroy those. And that went through actually several decades to try to come up with technologies that we would call safe technologies. And the National Academy of Science got involved in reviewing those with them. And then as part of it, the Surgeon General's office and later CDC would review them to ensure that they were indeed protective of human health. The primary method that was originally zeroed in on was the incineration, which over the years has had a very bad rap and is actually banned in many countries. And that slowed progress with the destruction because we had to help both the National Academy of Science and the Army come up with questions and answers on how this technology would be safe, and that the chemical particulates wouldn't be going out through the stacks and endangering the public in even a larger radius than originally anticipated. So they developed a lot. We developed monitoring systems to detect agent. They worked with the MAX, the best available technology that they could come up with for the destruction. And then they also developed, in response to a lot of environmentalist concerns, even after we were able to prove the effectiveness of incineration, came up with what we would call a chemical process, and which is really a hydrolysate, which is destroying the actual chemical agent in a water and sodium hydroxide solution. Most of the vesicants, the lesser so the arsenicals, and the nerve agents do hydrolyze in water, though they have different half-lives. But when you add the caustic in, you add temperature, you add stirring, and then it decreases dramatically. But one of the biggest problems is it generates a lot of liquid waste. And then also too, for the ones that any of the shells that they were in, the mortars, rockets, even ton containers, those couldn't be chemically destroyed. And so we had to come up with a method of thermal destruction that would still meet the criteria for incineration. So it's been a long road to destroy these, but the technologies have been pretty well maximized now and are pretty efficient, along with the facilities they set in and the number of safeguards they have to protect, again, the people working there and the people in the surrounding communities.
This is fascinating, the intricacy of this process and the importance of safety and environmental health and all of this. And I really appreciate what you do for that. Now, I understand we've had storage areas as well. I know our state of Alabama had a stockpile site in Anniston, I believe. So I think storage is something that people have heard about and have been concerned about. Is storage also a risk? Is this, a risk that is greater to manage than the actual disposal operation? How do these compare? If you can just, in general, give us a general statement on that.
Well, yeah, there is a risk of storage because over time, the shell casings, the fuses, and so forth, the plugs in a ton container for mustard or nerve agent all deteriorate and they begin to leak. And then when you add the rockets into the mix, the rockets are self-contained, so they're in a what's called a firing tube. And then they had to put in a lot of static electricity protection and a lot of lightning protection because they could be literally launched under the right circumstances. And then as they corrode, there's concern that they may destabilize. So the storage risk is high, gets higher every year, and the storage risk versus disposal operations is at least a factor of 10 higher to store it over time. So storage was not a good long-term solution. We had to come up with a way of actually destroying those, disassembling them, and ensuring they could never be used again. So that's why we began in earnest, even though we had some time to deal with this. Materials that are in the last two sites were designed and filled in the late 1950s. So they're over 60 years old. And just like people that start getting up and getting older, they don't get around so well and they don't do so well as we get older. So we really have to destroy them.
That's a great general lesson for all of us that work in safety and environmental health to really consider this when we provide advice, public health advice regarding these chemicals that are stored around us, whether they're chemical warfare agents or even just your regular toxic industrial chemicals or toxic industrial materials. Big lesson for all of us. Now, certainly, this is a multidisciplinary field. So, who do you collaborate with this in your day-to-day job? I mean, is this a bunch of engineers, chemists? Can you please just describe the field? And if I want to go and pick up a career in this area, what should be my credentials? And I'm asking these questions because our podcast will be listened to by a number of young professionals looking for career pathways.
It's a unique program in a lot of ways, both within CDC and within the Department of Defense, as well as a lot of other agencies that deal with weapons of mass destruction, of which these are part of that classification. Primarily in ours, we are engineers. I'm a chemical/safety engineer. We have industrial hygienists to assist and do help with the monitoring. We have environmental engineers. So it takes a lot of different disciplines. The primary one, and then for monitoring and doing any chemical analysis, obviously, we use a lot of chemists. So we have had and statisticians. So just about any discipline would work well, but the primary ones for us have been engineers, physicians, to help with medical countermeasures and signs and symptoms. Toxicologists we've used, and then we also have, like I said, industrial hygienists and just the whole gamut. So all of those are really, really good. If you're talking about environmental health, they all have key roles to play, from understanding the technology to being able to explain the technology to the public, to being able to make sure that we stay within the budget that we're allocated.
Yeah, thanks for the shout out for toxicologists. That's, I believe, how I met you years ago,
Yes.
over 15 years ago, as a young medical toxicologist, and I think this is certainly an area of deep interest for many of my colleagues. And as a matter of fact, I always mention in my presentations on chemical warfare agents how when I was learning toxicology, this was more of a historical knowledge that I was learning about chemical warfare. It's really sad right now that these issues surrounding chemical warfare agents are just as relevant they are today as they were during World War One. Are you all dealing or having to deal with some of these emerging incidents with chemical warfare agents?
Yeah, originally when we started the program, we had the stockpile, which everybody's heard that term, and then the organization, or the Chemical Weapons Convention, also talked about some that we refer to as non-stockpile or recovered, and those are the types of items that I said earlier. Some of them were buried and burned. Well, not all of them burned, and a lot of them that were buried still have munitions in them, and they're actually in 40 of the 50 United States. We've found various weapons of some type that have some chemical agent in them. So it's still a problem from that point of view. Still a problem in Europe, as anyone who's been over and gone through the Netherlands and France have seen. And it's also, unfortunately, a problem with some of these can actually be made, such as the sarin that was made in Tokyo in the 90s. And it's not exactly easy to do, but it's not impossible to do. So even though we're going to destroy the stockpiles of what we have, as you said, we're still dealing with them. We still have to know how to deal with them from a medical and toxicology standpoint. And then also if any are found, we have to know how to dispose them safely as well.
Yes, indeed. I think it's unfortunately this field is not a field that is a historical field. It's still a very relevant area of research, area of even work and education. And I really I'm grateful to the CDC for all the work that they've done in this area over the years, decades. And this is why I think our center at UAB is really dedicated to researching arsenicals, which you mentioned as well in your presentation. Are we still going to see lewisite popping up in these non-stockpile sources in the US, you believe?
The lewisite was one of the smaller amounts that was made, just because it had highly corrosive properties, and Adamsite and lewisite were probably the most common. Um, but the lewisite in the stockpile is all gone. However, the lewisite that was buried or still in research facilities, which periodically turn up, it is still there. So it is not a problem that will go away. And then some of the precursors that were used to make these arsenicals are still around as well. And we still find those in some of the old sites where things were made and got other uh, and evolved over time. It is not going to go away by any stretch of the imagination.
Which is reassuring that our center is actually actively involved in developing countermeasures and better understanding of the mechanism of toxicity that would apply to lewisite and other type of vesicants. And I think this will be of great benefit to the public and the community at large. Again, I really want to thank you for sharing your decades of expertise and experience in this important topic. I'm actually personally very proud that we were able to bring this to our audience. This is a unique topic by a unique speaker, and I'm really appreciative of your time. And thank you for tuning in, all of you who are listening to this podcast. I hope that you will also get an opportunity to view the recording and also follow us and stay tuned for additional podcasts and presentations over the coming years. So thank you.
And thank you for listening. Please tune in next time for another episode from the UAB CounterACT Research Center of Excellence in Arsenicals.